Right, so just quickly, I thought I'd like to talk about sleep. Um, One of the things that, as they say, it's my precious. If you as a bipolar don't look after your sleep, then expect trouble. Um, so just a couple of things that I found. It's obvious things, but it's funny what you'll miss when you're anxious and irritable, and you're finding reality a little bit difficult. So just a couple of things. At the moment, I'm sleeping fairly well and coping fairly well. So let's look at some of the things that are helping me. So what do I mean when I say I'm sleeping well? I'm sleeping more than 7.5 hours a night for more than 5 nights a week. So immediately people will go, I work hard. How can you, I've got kids. Well, if you can't get around to 7.5 hours of sleep a night and you're stuck with a diagnosis of bipolar, you're going to have to try harder. Then the other 2 nights, I don't sleep less than 6.5. No alcohol within 2 hours of going to bed. I'm not sure exactly what the latency or what the effect is. How long before sleep you're supposed to not drink alcohol, but I try to not drink as much as I used to and drink less and less, and make sure that I don't have anything that will make my cells more irritable going going to sleep or around bedtime. Then also endorphin producing exercise 5 days a week. So what I mean with endorphin producing exercise, usually impact exercise, running, tennis, push-ups. So basically exercise that cause inflammation in your muscles, that cause your nervous system to pick up that you're creating inflammation, and that send message to your brain that cause release of endorphin in your brain, and endorphin receptors to be stimulated and give your cingulate cortex a bit of a signal that you can relax. I've posted quite a bit on that, but if you'd like to read up on the cingulate cortex and endorphins, just Google it a bit and you'll see that there's a significant amount of literature on endorphins and exercise and mood. Yes. And then I live in a sunny country, South Africa. It sometimes can be, not so good to be in the sun, but so you've got to use sunscreen. But I tend to get up to 25. I try to get up to 25 minutes worth of sunshine on my skin. Arms. Sometimes I do exercise with the shirt off 5 times a day. 5 times a day. 5 times a week. So 25 minutes, 5 times a week. Vitamin D. Once again, do your reading. You'll find that the effect on mood is significant. And then obviously if you're talking about sleep, you always got to, and bipolar, you're always going to have to look at medication. I've first got to qualify this little bit of information. This is what works for me, and bipolar spectrum is each individual's medication and treatment and management is unique. So don't quote me on this. Don't say that I said this is the only treatment. Speak to your professional advisor, the medical practitioners, medical professionals, your psychiatrist, your doctors, and your psychologists before you you get a prescription for any of these drugs. Some of the drugs that I use, one of them is Topamax. Use no more than 50 milligrams at night. It is a great drug. It slows you down a bit, but you've got to be careful not to take it in too high doses, because there have been, I've seen anecdotal studies of patients becoming psychotic on high doses of Topamax, so it can be dangerous, so be very careful, but it's nice. It suppresses the appetite a bit, and it slows you down a bit around bedtime. Well, Butrin, it's a serotonin, norepinephrine acting drug, so it is seen as a anxiolytic antidepressant, and it works quite well. Slows, calms you down a bit. Calms me down a bit, slows me down a bit. Quetiapine is a atypical antipsychotic with a significant effect on antihistaminergic effect. Excellent, excellent sedative effect. I use doses between 50 and 300 milligrams at night, depending on how much I need. How much I need to switch myself off, and how alert I am, and how much sedation I need. And then sometimes intermittently I'll use one of the old antidepressant anxiolytics, amitriptyline, 25 milligrams, very low dose, very, very nicely anxiolytic. And then also I sometimes use a low dose of 25 to 50 milligrams of antihypertensive, but also adrenaline blocking, beta blocking drug called propranolol. I'll post all this little PowerPoint that I set up for myself, and I'll post that on the page with the video so you can have a look. Once again, this information you need to check up with your medical professionals. Please don't use any drugs, be it legal or illegal, without prior information. And then, once again, just to emphasize, if you have any sort of mood pathology and you've had any sort of psychotic break or mood instability that has caused dysfunction in your work, personal life, or whatever, for instance, bipolar 1 or bipolar 2, protecting your sleep is paramount. So don't mess with your sleep. It is the most important thing ever. So it's funny, when I was a student, I'd do pull all-nighters. It's just the worst thing ever for somebody who has a brittle mood. So don't mess with it. Please take this video and this information to heart. And if you do take this and you do hear this information and you do look after your sleep, you'll find the effect profound, and you'll see how it changes the landscape of your mood and your interpersonal relationships, work environment, home environment, in your days and weeks, as you slowly change your habitual sleeping patterns, if you look after your sleep and your circadian rhythms. So please try your best.